it's Anna-Kaisa with the third episode of Life DI. As I mentioned before, this time around I was at the liver and kidney transplant unit. In this service, the patients have just had a liver or kidney transplant, or they have liver or kidney disease and are waiting for a transplant. This was a pretty challenging rotation because there are so many things I have to take into account when I care for these patients. For example, renal patients, they usually have to restrict their potassium intake, their phosphorus intake, their sodium intake, their fluid intake, because their kidneys are not working very well. So all these electrolytes and fluid, they are retained in the body. So, and this can be a life-threatening situation. It's like, for example, if potassium gets really high in the blood, this could cause cardiac arrest, for example. I was also taking care of end-stage liver disease patients, and they are also pretty complicated because sometimes, for example, they may have a lot of fluid accumulation, ascites, and this can put a lot of pressure on the stomach, which means that they get full really easily, and so they cannot eat as much as they should. And when you have a liver disease, your liver is not making enough glycogen either, so if you go too long without eating, this means that the body is going to take the fuel from the muscle tissue or the fat tissue or both, and this can lead to a lot of problems in the long run. So there's also a cystic fibrosis patient on our floor, which is pretty unusual, and I was happy that I got to do their nutrition assessment. Cystic fibrosis patients are also pretty complex because they're commonly underweight because their lungs are, there's a lot of mucus in their lungs and it makes it really hard for them to breathe, so the increased work of breathing causes their energy needs to be higher. Also, often there is pancreatic insufficiency, which may mean that they have diabetes, and so that has to be taken into account. They have to have constant carbohydrate intake during the day. They also might have, they might not make enough enzymes to break down the food they eat, so this requires pancreatic enzymes to be taken in pill form, and this also may mean that they are not absorbing all the fat and all the fat-soluble vitamins, especially as they should, and so this can lead to micronutrient deficiencies as well. Overall, this was a really tough rotation, but I think I did pretty well. I did notice that I'm not quite as quick with my note writing as I should. I noticed that the RDs, they have 6, 8, 10, even more notes to write every day, and so far I've been writing just 2, maybe 3 a day, so this is not quite enough if I'm to take care of a whole service in the long run. But I look forward to improving on this in my next rotation, which will be at Mission Bay Hospital, and over there the service comprises of the whole adult hospital, so we're going to see patients that have had GI surgery, maybe head and neck surgery. There's also pregnant women there, so maybe they have gestational diabetes, and so there's going to be a lot of new kinds of patients for me to see there, and hopefully I can improve on my note writing speed there. But stay tuned for a video after that, and if you have any comments, please leave them, or questions, please leave them under the video, okay? Bye!